So I want to actually look at another aspect of cesarean sections, right? So this is what emergency cesarean sections in disaster zones. Emergency cesarean sections in disaster zones. Okay. So these just have to do with, they're just critical procedures. So you have to make, when you say that there's a cesarean section and it's a disaster zone, you have to make a decision, and the decision has to be very fast. The decision has to be accurate. All right. Now this is because you want to save the life of the woman, you want to save the life of the baby. So fetal distress, So like situations where you have to make this disaster zones that we are talking about, that you have to make decisions whether you want to do a cesarean section. If there's fetal distress, so if the baby's heart rate is like declining, the heart rate is just going down, it's just going down, it's just going down. All right. Then placenta abruption, so there's premature detachment of the placenta, so of course the baby can no longer be getting the adequate oxygen that they need and all of that. If there's uterine rupture, if there's a prolapsed umbilical cord, all of these are disaster zones that if you waste time, the baby might actually lose their life. So you could see this, right? A cesarean section. So in disaster zones, the challenges are amplified due to limited resources, right? So probably you guys didn't prepare for this condition, and you are having this condition, but you still have to take the decision anyway. Infrastructural damage, so hospital and facility may be destroyed or compromised, requiring medical teams to operate in challenging environments. So key considerations for this emergency cesarean section in disaster zones is, if a decision is to be made, it has to be rapid. The communication during this time has to be very, very clear. Do you understand? So it has to be very clear, all right? Then you have to prioritize the patient's safety. So any decision you are making, it should be of more advantage to the patient. You understand? So one thing is, the healthcare professionals should always be trained for times like this. Emergency kits and supplies should be made available. Coordination and collaboration, should be ongoing, all right? Because these things, one organization can't really handle it, right? So coordinations and all of that should be in place.